Hi, good morning and good afternoon, everyone. And thank you so much, Bhargavi and Wakar, for inviting me to share some information about the COVID-19 microgrants program. I'm sure Bhargavi already mentioned, or maybe Wakar, that microgrants program is only a part of the range of initiatives led by TCI. And I'm going to share my screen now to let you see a small presentation that I prepared. And here, okay, let me go full screen mode. Okay, so here you can see the logos of the organizations that are leading and supporting this. So we have TCI as the managing organization, financially supported by the International Disability Alliance. I'm sure a lot of us are familiar with them. And of course, BAPO Trust for Research on Mind and Disclosure as as an organization providing management and administrative support for this program. But aside from them, this program is also supported by other organizations like the Open Society Foundation, Wellspring Advisors, and DFAT Australia. And this was initiated last year during the initial months of the pandemic when different levels of lockdowns and community quarantines were imposed in most of the countries globally. And we all know that of course everyone has been impacted significantly by these restrictions, but greater for persons with psychosocial disability. And we have noticed that we're not really included and visible in the government's programs and responses. So that's a huge gap that TCI wanted to address. So the microgrants program were originally intended to address the mobility issues of persons with psychosocial disability and also strengthen and promote peer support system in the communities, and also strengthen the capacity of organizations to promote and continue the advocacy work, not only short-term advocacy, but also looking forward and continuing the longer-term advocacy targets. These microgrants were also intended to be implemented at the national level with national scope. So we had selected 6 partners in 6 countries. So we have one in Fiji. We have a partner there called the Psychiatric Survivors Association. And then in Indonesia, we have the Indonesian Mental Health Association. In Nepal, we have Koshish National Mental Health Self-Help Organization. In Thailand, we have Living Association. In Malaysia, we have MIASA, or Mental Illness Awareness and Support Association. And in Pakistan, we have the Special Talent Exchange Program, but they're really a host organization for a national network called the Psychosocial Disability Rights Network, or PDRN. So these partners have varying capacities and levels of influence, and their establishment, year of establishment, and years of working in their own respective countries also vary. But we have recognized that they really play a crucial role in promoting the rights of persons with psychosocial disability, especially given the situation, the reality at the moment that we don't really have a lot of organizations working on the needs and rights of our community. So the programs differ, but seen as a whole, they're really all promoting rights-based approaches and also holistic interventions to support the, like the other organizations like TCI, really promote the autonomy of persons with psychosocial disability. So there are initiatives focusing on well-being, wellness, on employment, promoting employment, strengthening networks and local organizations, awareness raising initiatives, capacity building, working with governments, and many, many more. So it's really it's really a blessing. We're grateful in TCI that we get to work with these partners who are also, been long-term partners already of TCI. We have continuing work with them. Yeah, so they received an average of 5,000 US dollars for their projects, ranging from 6 to 8 months. So like I said, these are really short-term projects, but also laying the foundations for longer-term advocacy work. And I want to share with you some key results and accomplishments that we have seen from the different projects that I just mentioned in the 6 countries. And there are 7 areas that we have seen. And the first one is on increased food security and access to income generation activities. We specifically saw this, for example, in Thailand, in the initiatives of Living Association, and also in Fiji, led by PSA. So they have initiatives on farming, organic farming, and really supporting their members in terms of providing farming kits and capacity development on how to sustain this, and perhaps in the future generate more income from these activities. But during the initial months of their projects, they were really addressing food security, which is more immediate for persons with psychosocial disability. And there were a lot of challenges experienced there, because the members didn't really have prior experience in doing initiatives like this, but they somehow engaged, other experts who could help them, and the results of their projects were really amazing. And while they were promoting or addressing food security, they also noticed that through these gatherings, they plant together, they farm together. It was also a space for strengthening their support to each other, peer support. So we're already seeing, cross-cutting themes there. And the next result area that we have seen is on improved nutrition, hygiene, and sanitation conditions through the distribution of relief goods. So these relief goods consist of food and non-food items. So for non-food items, of course, these are hygiene and sanitation kits. And again, this is in response to the gap observed in some countries that persons with psychosocial disabilities are not receiving any immediate support from the government. So STEP in Pakistan, for example, and Koshish in Nepal did such initiatives. And of course, we have heard positive feedback from the members that it has really helped, address some of their needs. And for Kashish in Nepal, it also coincided with the local festival, where they really celebrate and prepare, food and share it among each other. And it was a good timing for them to distribute these goods, because it also helped the members feel that they have something to share. So yeah. And then another result is the strengthened capacity of OPDs to respond to the needs of people with psychosocial disability. So there were also different initiatives done here, like in Living Association, they have set up centers like training centers to support farming, and this center is going to continue to provide support to increase employment opportunities for their members. And in Malaysia, through MIASA, they formed a crisis team composed of volunteers who are providing peer support and trauma-informed care to not only to their members but also other individuals who are really coming forward and getting in touch with them to ask for support. And yeah, so these trainings were provided, and they also have set up a clubhouse that can be used for implementing initiatives together. And some of the activities that they do are focused on arts, crafts, and music, healing, and etc. And then in Pakistan, um, I mentioned earlier that STEP supported and is continuing to support PDRN, the national network there. And some of the support that they provided is on setting up different social media platforms where they can leverage their awareness raising initiatives and advocacy work. And so, yeah, we can notice that there are different levels of support provided to members and member organizations in terms of capacity strengthening. And yeah, then result four, of course, we have observed strengthened peer support system. So I already mentioned a little bit of this in the beginning related to addressing food security. But other than that, there were organizations that really focused and implemented targeted activities for peer support. In Fiji, for example, in PSA, they organized a series of listening circles for their members where they share their struggles during the pandemic, what things are motivating them, how they can support each other as well, and share different experiences basically, and also good practices in terms of maintaining hygiene, how to deal with family members and stressors. So a lot of different topics involved. Similarly, in Nepal, in Koshish, they also did something like this, virtual meetings, similar to the listening circles, and also one-on-one conversations with their members through phone calls. And of course, there are different situations in terms of mobility restrictions. But towards the end of their projects, of course, it was common that most of them shifted to online forms of these gatherings. But we also noted that it's not really limited. Peer support system is not really limited to just talking about, each other's struggles, but also being there to support when members are experiencing challenges in their own families, and in the community in general. And I would like to share more about this later. So really, interventions within the family, and when they come into contact with the law, with law enforcers. So the organizations were also there to support. And we see this as something bigger, like community support, really. And of course, that's something that we want to continue to promote. Another result is the improved data collection and research on the situation of people with psychosocial disability. This is not really intensive, but in Indonesia, through MIASA, they're working with social care institutions, and they observed from the very beginning that the government was not collecting information about the situation of the residents in those institutions. And they're not also providing services there, and they are highly exposed to COVID. The risk is just high, but there are not even information about them. So um, IMHA visited several institutions and counted the numbers of members who might have been affected by COVID, because they were also not doing testing in those institutions. So they also interviewed residents in terms of their needs, and of course, IMHA compiled all these information and used them to support their advocacy initiatives that came afterwards. And another result area is the increased awareness among various stakeholders and the general public. So this is something done by almost all organizations in many different ways, but a lot of them engaged with community members and the general public through consultations, through webinars, trainings, etc. And not only ones that were initiated directly by them, but also when they get invited in other webinars organized by other organizations, they took those opportunities to really discuss and surface the issues of persons with psychosocial disabilities. So there were a lot of opportunities grabbed there. And the last result area was on improved accountability of duty bearers to respect, protect, and fulfill the rights of persons with psychosocial disability. So this was strongly shown in Indonesia. And also we've seen some efforts in Thailand, where they engaged with the Senate to share their position paper and demands for the government to support and address the needs of persons with psychosocial disability. And in IMHA, they had several lobbying efforts and meetings with different ministries of the government, not only to push the inclusion in terms of testing, but also in getting prioritized in the vaccination program that came later on. And as I've mentioned earlier, they were also pressuring the government to really gather information, collect information about persons with psychosocial disability. And there were commitments made, and now way forward, of course, it's more issues on how to institutionalize this and promote the inclusion of persons with disabilities into the larger discussion of social protection, and also emergency situations, and health emergency situations like this one. Yeah, so we also observed some emerging themes and trends that were related to these results. So the first theme, for example, is responding to cases of abuse, gender-based violence, and rights violations through online and face-to-face peer support. So I mentioned earlier that PSA in Fiji and Koshish in Nepal were supporting their members in terms of peer support, but they noticed that there were also cases of abuse in families, and contact with the police officers, where members really needed support because they were experiencing violation of their rights. So it's something urgent that was not really foreseen in the projects, but the organizations had to respond to them. And of course, looking forward, there also has to be some capacity strengthening for the partners, for the organizations, to be able to respond more effectively and efficiently to these cases. The other theme is really, as I mentioned earlier, underscoring the need to intensify advocacy and awareness raising on social protection for persons with psychosocial disability. We know that our members do not really have a lot of resources to respond, accessing resources to address their needs during emergencies like this. And we already noticed that they're not we're not even included in stimulus programs, for example, and other social protection services. So this has to be strengthened more. And the third theme is promoting digital inclusion and accessibility for persons with psychosocial disability. Similar to the previous one, our members have limited access to the internet and the equipment, the technology to be able to engage and access that platform. In the different projects, they were able to identify solutions to address this. They provided specific support to their members, especially in terms of using, for example, mobile phones, how to connect to the internet, etc. But it's also something that could be overwhelming for the members. So they also noticed hesitation to engage in such initiatives that are done online. So yeah, this is also an issue of resources. And moving forward, there were also other pressing issues and urgent discussions that have to be addressed. For example, really doing budget advocacy, because at the end of the day, these programs, these pressures to the government are not really going to happen without commitment of resources. And we've heard, especially from different perspectives from TCI as well, from Bargavi, that this is not only about providing resources for current gaps, but also addressing the previous violations of rights of persons with psychosocial disability. And also strengthening collaboration, of course, with different agencies, organizations, and even not just in the cross disability movement, but also other organizations, like for example those working with women and girls, those working on disaster risk reduction, etc. Because this is something that has to be mainstreamed. So yeah, so there's a lot of opportunities, and we hope that there would be continuing programs to support and sustain the gains from these micro grants. So I hope these information helped you gain a better understanding of some of the programs of TCI. So if you have questions, I'm sure Bhargavi and Wakar would be there to support me. As I've said, I apologize, I am not able to really join you in this meeting. So yeah, that's about it. Thank you so much, and yeah, I hope you enjoy the rest of this session.